So patients want to know what's the difference between hemorrhoid artery embolization procedure or Hembo procedure and a rubber band ligation. Both are minimally invasive and can be done as an outpatient. So what's the main difference? So I think the number one big difference is that one involves an intrusive anal type of procedure. The rubber band ligation has to be done through a transrectal or transanal approach. So that's uncomfortable for the patient. Even though it can be done with local anesthesia, it is an uncomfortable thing for a patient to endure, as opposed to hemorrhoid artery embolization procedure does not involve anything to do with the anus or the rectum. It's a procedure that's done through a little IV that was started in the groin and does not involve having to go to the backside. Number two is the effectiveness. The rubber band ligation procedure is only effective about 50% at 1 year, whereas the embolization procedure is effective. About 90% of the patients don't have any kind of reoccurrence even after a year, whereas the band is not as effective for the long term. Those are the two main things. The other thing is that the banding procedure is done by a gastroenterologist, whereas the hemorrhoid artery embolization is done by a interventional radiologist. Both are done as an outpatient. The recovery times are pretty similar. I think the embolization procedure, you return to work the next day. I think with the banding, it may be a few days of pain that you may have to deal with, and may have to take some pain medicine for the banding procedure. But in any event, if you were looking for more information, feel free to email us back on this email chain, and we'll get you a lot more information about both of these procedures and other procedures for your hemorrhoid with an assessment that's tailored to you. Take care.